Hello everyone, my name is Nora Miller, and for today's fact debate, I will be discussing how medical marijuana and its health benefits outweigh its recorded health risk. When many people hear the term marijuana, they often think of the recreational use, when in reality, marijuana has many health benefits and it can benefit these patients that are suffering from these conditions. So, some of the physical benefits of medical marijuana are that it can be used to treat chronic pain such as arthritis, nerve damage, back pain, and joint pain. There are also some medical conditions such as multiple sclerosis, and with these medical conditions, patients often have muscle spasms that can be very uncontrolled. And so, medical marijuana can kind of ease the muscle spasms and it can be more controllable. Cancer patients are also often prescribed medical marijuana, especially if they're in a lot of chemotherapy, just because chemotherapy has many side effects, and some of those can be nausea and vomiting, and the medical marijuana can help ease that sensation of the nausea and vomiting. So, cancer patients are also often prescribed medical marijuana if it is legal in their state, of course. Some advantages that medical marijuana has over other medications are that it can lower the risk of overdose compared to painkillers or opioids. Many patients that are prescribed painkillers for their chronic pain often get addicted to these painkillers, whereas marijuana doesn't have the same addictive chemical that these painkillers do have. Another thing is that it is available in many forms, such as edibles, oils, vapes, whereas if a patient is prescribed an opioid or a painkiller, they often come in a pill. And if the patient is struggling to take a pill, then they don't have any form of that medicine to take. Whereas if they're prescribed the medical marijuana, they can take it in an edible, they can have an oil, or they can do it out of like a vape thing, which allows patients to choose what's best for them. So, medical marijuana may reduce the need for other medications. Many patients that are not prescribed medical marijuana often have to take other medications to relieve their symptoms. So, if a patient is prescribed a painkiller or opioid, sometimes they may have to take multiple doses of that medication each day or go up a higher dose. And whereas medical marijuana, you do have to do it multiple times a day, but you don't have to go up a dose. You can just do the same thing over and over, and so your body gets more used to that instead of taking multiple medications for the same symptoms. Another thing is that the side effects of medical marijuana are extremely manageable. So, whereas the side effects of chemotherapy, they can be kind of uncontrolled and not as manageable, and the medical marijuana can help ease that sensation, like I said earlier. So medical marijuana also, it just improves the quality of life for many of these patients, and so it is a very good thing to have in our health systems today. Thank you.